Singapore was initially hailed as the gold standard in how to curb the coronavirus outbreak without shutting down the economy. But this week that changed, with a record number of new infections reported. The government has now closed schools and many businesses for at least a month. Well, joining us now is Dr. Danielle Anderson. She's the scientific director at Duke Medical School in Singapore, and she joins us live now. Thank you very much for talking to us. Just give us an indication. What happened initially back in January when Singapore decided to put in quite strict measures to contain the virus? What worked?
So in the initial stages of the outbreak, the government was very, very prepared and, excuse me, knowing that this was going to happen. And the initial cases were very extensively contact traced, and we were able to curb the spread of infection by quarantining everybody immediately. And the contact tracing was very, very effective. So one of the really, really important things that happened at the very beginning was government and private institutions and hospitals and universities, everybody worked together. So Duke NUS Medical School is one of those places where I work. And this school is, we do research primarily, but the government recognized that we would be able to help in set up diagnostic assays and set up testing to identify those patients early on and also develop new assays. So that was before the switch, early on, like you mentioned. Then what happened was, once the cases worldwide started to pick up, and what we're seeing is the epicenter shifted from China to Europe and the US now, people started to come back into Singapore. And then this is the second wave that what we're seeing now. It began with imported cases where people were flying back, and then that led to further local transmission. And then now the government has implemented a circuit breaker measure to curb the second wave of infection.
Because, of course, you don't want to jeopardise what was a very successful set of strategies just a few weeks ago. Lots of governments, as we've just heard, are looking to see what their exit strategy might be. What can they learn from Singapore in terms of what's worked? And as you've just talked about, how to avoid new locally transmitted infections spiking up again.
So I think it's still very important that everyone, once any either lockdown or circuit breaker measure or any of those restrictions are stopped, I guess, we can't let down the guard, because if we have other cases coming up, exactly what you say, we'll see the cases spiking again. And it's really worldwide, I guess, the measures are put in place to wait for a vaccine or a treatment or the things that everyone's working on at the moment to be able to treat the current infection. So it's still important to, once the pressures are eased, I understand that everyone wants to get out and get back to their normal lives, but we really, really do have to take care to still look at the social distancing policies and take care. Remember that the infection's still not gone away, and it is to, I guess, be hesitant in like going back to those really close contacts with people and not ease up the pressure just yet.
Thank you very much for talking to us. Of course, we know Singapore has got far fewer cases than some of the European countries we've just been talking about. Really appreciate your time, Dr. Danielle Anderson, Scientific Director at Duke Medical School in Singapore.